Good morning, introduced. My name is Francisca Ria from the Information Technology Study Program. This time I chose the theme about coronavirus. Here is the explanation. Coronavirus infection is a disease caused by the coronavirus and causes the immune system in the form of respiratory problems. This disease is in the spotlight because of its emergence at the end of 2019 for the first time in the Wuhan, China. The location of inference for the first time has made the coronavirus, also known as the Wuhan virus. Besides China, the coronavirus also spread rapidly to various other countries including Japan, Thailand, South Korea, and even the United States. Cases of coronavirus. The causes of coronavirus is a single-stranded RNA virus that come from the coronavirus group named coronavirus because of its crown-shaped surface. Crown or corona. Another virus that belongs to similar group is the virus that causes middle respiratory syndrome and severe acute respiratory syndrome several years ago. However, the coronavirus from Wuhan is a new virus that has never been identified in humans before. Therefore, this virus is also referred to as the 2019 novel coronavirus or 2019 coronavirus are commonly found in animals, such as camel, snakes, from animals, cat, and bats. Humans can be infected with the virus if there is a history of contact with these animals. For example, on farmers other in animal markets. However, the explosion in the number of cases in Wuhan, China showed that the coronavirus can be transmitted from human to human. The virus can be transmitted through droplets, which are very small water particles and usually come out when choking or sneezing. If the droplet and inhale or in contact with the coronal layer of the eyes, a person is contracting this disease. Although anyone can be infected with the coronavirus, those who are elderly, have chronic disease, and have low immune system are more susceptible to this infection and its complications. Symptoms of coronavirus. Coronavirus symptoms vary, ranging from the common cold to severe respiratory disorders, such as pneumonia. Corona symptoms that are commonly experienced by those who have a coronavirus infection are high fever with chills, dry throat, have a cold, runniness and sneezing, sore throat, hard to breathe. Symptoms of the coronavirus can get worse quickly and cause respiratory failure to death. Centers for Disease Control and Prevention (CDC). Symptoms of 2019 nCoV virus infection can occur from 2 days to 40 days after exposure to the virus. Coronavirus diagnosis. Coronavirus infection is generally not through the symptoms and physical examination that the patient complains of. After that, the doctor will perform a number in investigation to help confirm the diagnosis. The supporting examination include complete blood count, blood clotting, kidney and liver function and virological examination in education. Specimen from the patient's nose and pharynx or throat will also be taken using a swab technique, similar preparation of sputum and necessary bronchial fluid or similar airways. Through this examination, it can be known whether the patent illness is caused by a virus or other causes. Meanwhile, the patient's blood plasma will also be examined to find the RNA of the coronavirus. For radiological examination, a case X-ray, the case CT scan might be performed. Most patients will show a picture of clothes in both lobes. Complication of coronavirus. Patients infected with coronavirus can experience respiratory symptoms such as severe pneumonia, such as high fever, shortness of breath. Complications such as respiratory failure, acute heart failure, and secondary infection caused by other germs can occur if the condition is not treated immediately or if the disease worsens very quickly. Coronavirus treatment. To date, no antiviral therapy has been shown to be effective against the 2019 novel coronavirus infection. Several antivirals that have successfully treated MERS-CoV and SARS-CoV infection before have not shown satisfactory results. To overcome this new coronavirus infection, patients infected with the coronavirus will receive supportive therapy to reduce symptoms. For example, antipyretics to lower body temperature and flu to prevent dehydration, as well as oxygen therapy in patients who experience shortness of breath. In severe conditions, ventilatory support can be given to the patient to support other vital organ function. Coronavirus prevention. Although the symptoms of coronavirus disease resemble other respiratory diseases such as pneumonia or influenza, so far there is no vaccine that can prevent the transmission of coronavirus disease. The prevention of pneumonia vaccines and influenza vaccines cannot provide protection against the spread of coronavirus infection. The best way to avoid coronavirus infection is to take active vaccines. The CDC recommends that everyone take action such as wash your hands regularly with soap and running water for at least 20 seconds. If water and soap are not possible or available, clean your hand using an alcohol-based and hand sanitizer. Avoid touching your nose, eyes, or mouth, especially if your hands are still dirty. Avoid contact with people who are sick. Stay home when you are sick. Cover your mouth with a tissue or by bending your elbow when you choke or sneeze. Avoid direct contact with from animals. Avoid traveling especially to areas with cases of coronavirus infection. Overeating meat that is not fully cooked. Maintaining nutrition by eating nutritionally balanced food, drinking a dose amount of water, and getting enough rest can also help keep the body in shape and avoid coronavirus infection. Everyone who experiences symptoms resembling a corona infection don't hesitate to immediately consult a healthcare worker and determine the source. Thank you and good afternoon.